So my research program aims to use patient samples to understand the molecular cellular processes that cause pediatric kidney disease in order to provide improved therapies for the patients and their families. Children with kidney disease have increased blood phosphate levels. And when children have renal failure, they can't get rid of it, so it goes high in their blood. And one of the goals to prolong life of children with kidney disease is to maintain the phosphorus levels in their blood in a normal range. So we've been using the money to understand how phosphorus is absorbed once eaten into the gut, with the end goal being to block the pathway. This opportunity in particular has really enabled the enhancement and expansion of my research program, doubling almost the capacity of the number of people I have working for me.
The Indigenous Youth Mentorship Program is a communal relationship-based healthy living after school program that's delivered by high school students for their younger elementary school peers in communities throughout Canada. Through the Stollery Science Lab, as well as a partnership with Everactive Schools, we've actually been able to support the mentor training of over 350 high school mentors and their adult supports. And now we have been offering the program in over 28 communities throughout Alberta. We're really excited about continuing to offer the Indigenous Youth Mentorship Program to additional communities. So in 2019, we actually were able to receive additional funding from the Canadian Institutes of Health Research. And we're looking to actually move the project into a not-for-profit. So that's something that we're really excited about. It's important for donors to invest in projects like these because an investment in our youth is truly an investment in our future.
The goal of my research is to improve the process of transition from pediatric care to the adult healthcare system. Many of them struggle with the process of leaving the pediatric healthcare system and entering the adult healthcare system. My research is aimed to facilitate that process by improving their knowledge of their health condition and arming them with some self-management skills and some self-advocacy skills. I was able to leverage funds from the Stollery Science Lab to obtain additional support from the Canadian Institutes for Health Research and Alberta Innovates. And through these additional funds, I'm working to create an app that will help teenagers who have heart defects to take responsibility for their health care. I've also started a recruitment process for a study to identify what barriers immigrant and refugee youth face as they transition from pediatric to adult care.
We've been really grateful for the support from the Stollery Children's Hospital Foundation through the Stollery Science Lab. It's allowed us to draw from lessons from our previous research in terms of how to identify and screen for some of the earliest signs of autism, and to take a questionnaire that we had developed by working with younger siblings of children with autism and now test it out in the communities. The funding has also been helpful in terms of pulling our team together to really start seriously thinking about how our current intervention could be helpful for younger infants. It's this kind of development work that's often hard to fund through conventional granting agencies. They're looking for something that's ready to just go out the door and be implemented. And we're so grateful for the opportunity to work with the foundation. I think the risk is that our current research would have stalled in the lab. We would have been limited to working just with families who have a child with autism and not really knowing whether the measures that we've developed in this special group would be informative in the broader community.
We're just very grateful to the Stollery Children's Hospital Foundation for this funding, which is really allowing us to take a simple technology, solar-powered oxygen delivery, to save lives in Africa. In the short term, this funding will allow us to complete our randomized trial across 20 hospitals in Uganda. Now, this study will be important in actually proving that solar-powered oxygen delivery saves lives. Our technology is an appropriate technology for low resource settings. What I mean by appropriate is that solutions for wealthy countries like Canada may not necessarily be applicable in low-income settings like in Uganda. If you go to a hospital in Uganda, there's frequent power outages. So our solution bridges power outages and provides an appropriate solution for that environment. Working with the Distinguished Researchers Program through the Stollery Science Lab has been a very gratifying experience. We've had nothing but positive interactions, and this has really allowed us to roll out smoothly.
For the past 15 years, we have been working together with parents to develop innovative tools to help parents make the best available decisions, taking care of acutely ill children.
We're continuing to create resources for COVID-19. We're creating a video, and we're engaging with our parent advisory group to ensure that the resource is helpful for them, that it contains the information that they need. We've also been doing work exploring how we can adapt some of our resources for different groups. So we're looking at how we can adapt them for parents and caregivers who may not speak English as their first language.
This funding has absolutely been crucial for our program to grow and thrive. And because of the funding, we are really viewed as innovators in this space. So these resources have been fundamental to give back to the community, to increase community engagement in our work.